Dr. P here. In this video, I'm going to talk about a couple things here. I want to make sure that you understood that when choosing your doctors, your healthcare practitioners, whether it be nurses or medical practitioners, allopathic physicians who are a little bit more lenient in terms of the profession, they may be geared toward nutrition. Somewhat is easier to work with them since we deal a lot in nutrition here. And then people like myself, your chiropractors, your naturopaths, napropaths, acupuncturists. So these are, you need to combine everybody. We believe in multiple forms of care. There's no one thing that's going to get you well, even though there's some people who do respond to one thing. But we don't believe in the all size, one size fit all type of therapy or with anything. And so the other thing is that when you do this here, before you embark on trying to fix a problem, because people are into self-care right now rather than the standard way of doing things in terms of illness, is going to have it checked out, getting a diagnosis from tests and observations. People are into self-care. And so we do see a lot of people who injure themselves in doing this because they really don't know. Basically, like I say, all of your conditions are based on some sort of irregularity or some sort of imbalance in the autonomic nervous system. And then either structure can cause this here, defects in structure, or changes in the diet affecting the autonomic nervous system. Hormonal imbalances can affect the structure. So that's why you need to have more than one form of therapy. And you also need to know exactly what your body is saying. Now, when it comes to disease, we know that there are about 4 different levels of disorders. And namely, like your energetic, that's something where you could do it yourself. You just take something as simple as constipation or a common cold. A common cold, you won't even notice that you have the symptoms yet, but the symptoms are there 72 hours prior to you even noticing it. But this is the energetic phase, a little hot tea, a little rest and whatnot, and it goes away. You may not even know that you had symptoms of a cold. Then the next one is the physiologic level. And in that level, that's where you have symptoms. The symptoms will persist, say for instance, a cold, runny nose, you start sneezing, scratchy throat. Your awareness is increasing, so you know that there's something that you need to do in terms of trying to alleviate these symptoms. It may take, depending on when you become aware, you've had it now, this is probably the 4th or 5th day, anywhere between 24, 48 to 72 hours. If you take measures into your own hands, it's something you can handle yourself. The next, and then the same way with constipation. With constipation, usually you can skip a day. You're stressed, you're busy, you don't notice it, and you may not notice until the next day. You say, "Oh, I didn't go have a bowel movement yesterday, so today I need to do something that's going to flush my system." See, so you may want to take a herbal laxative tea, and you're back on track. But then, and that's the energetic part. But when it becomes physiologic, you notice that you start to have symptoms. Your back hurts, you're bloating, you're expelling flatulence with the urge to go, but nothing comes out. You may have headaches, a little dizziness. So see, this is your physiological phase. Now, when we get to the next phase, okay, these 2 phases, you can kind of help yourself. And some people do that. The majority of people do that. But when you get to the 3rd phase, that's the pathophysiologic phase. That phase there, we have some sort of recognizable disease or disease that you may not recognize that need to be tested for. And so this is the phase that will send you to a healthcare practitioner. Now, people who try to do this on their own usually end up going through the emergency room because they will have, it gets worse. Okay, for instance, like a common cold can turn into bronchitis. Bronchitis can turn into walking pneumonia. Walking pneumonia can turn into a full-blown case of pneumonia. You can die from that. See, then same thing with colon disruption. Any type of colon problem that you may experience, if you don't handle that, it may lead to something else. So the first thing that you would do with the uncomfortableness of the situation is you'll try to push, which means you're going to strain. You strain, you may pass blood. You pass blood, you may develop external hemorrhoids. External hemorrhoids or internal hemorrhoids are generally a sign of portal hypertension in your liver. So we want to make sure that we take care of that, make sure we handle it and know exactly what it is. But now continue bleeding like this here, that needs to be investigated. So you can move from there into a pathological phase. See, something that you don't know. You think it's something simple as a hemorrhoid that you're bleeding occasionally and whatnot. When you go in for a lower GI or colonoscopy examination, you find out that you have polyps, you may have diverticuli. See, and so these are pathological findings that can lead into more serious disease. So it's important for you to recognize those different levels of illness and also be aware that they are disruptions or some sort of alteration or imbalance in the central nervous system. So the autonomic nervous system. So everything in terms of your health is based on the autonomic nervous system and your nutrition. It's basically it. Now you can manipulate, so the dispensation of herbals, pharmaceuticals, different manual therapies is the practitioner trying to manipulate the autonomic nervous system. Sometimes we'll use nutrition to do that because, like I've said before, some patients who find out that they're sympathetic dominant, which is a person who would need a alkaline diet. The alkaline diet follows sympathetic dominance of certain hormones that are secreted during stress, and the autonomic nervous system under the sympathetic part that's dominant is for stress. Okay, and right now this is a stress cycle. I'm wide awake. I'm aware of my surroundings and whatnot. There may be things that I want or do not want to happen around me, and so that leads to an increase in stress hormones. So the other thing is a person who goes to sleep, and that is a person who is parasympathetic dominant. When you're parasympathetic dominant, you basically change the secretions. So we know we have cells that are secretory cells. These secretory cells basically secrete something, okay? In the case of hormones, they will secrete hormones, usually from the foods that you consumed in the daytime when they're in the process of digestion. During the sleep phase, the secretory cells will secrete hormones from certain glands, and they will travel in the bloodstream. Then once they go through the bloodstream, they will go to areas where you most need whatever that hormone is. So, and that's why you wake up, you should feel really good. If you don't feel good, you feel like you've been running on a treadmill in your sleep, then you had the wrong nervous system functioning when you were trying to sleep. You had some of your sympathetic nerves during that period of time during your sleep cycle. You should be in parasympathetic phase. You had some of your cortisol being secreted. See, your body was laying down, but you did not rest. And so now you're in a stress cycle in your sleep. And so when you wake up, you may notice your blood pressure may be elevated if you take it when you first wake up, which you shouldn't. You should wait till your body gets adjusted to sitting up, moving around a little bit, then you calm down, then you take it. But if you take it as soon as you wake up, it should be elevated. The same way with your blood sugars. If your cortisol was up in your sleep, your blood sugar is going to be elevated. So these are things that you may have noticed, and but they can be changed. They can be manipulated. And so just like as a chiropractor, I would manipulate the spine to try to get alignment of the vertebrae to take pressure off the nerves. Certainly the neck, this area up in here, especially the very top one, C1, which is the first cervical vertebrae. You have C1 and C2. You have the vertebral arteries coming through there. A lot of times when you have rotation or distortion movement in that area, you're going to have blood pressure issues. You may have brain stem issues. How can we tell? People sneezing, they have certain allergies, they have headaches, migraine headaches, they won't go away with medication. These are things that need to be checked out as far as the spine is concerned, because we know that you can have an elevated blood pressure and you can have migraine headaches due to spinal distortions. So another thing that I want to talk about, I hope that kind of helps a little bit, is there's a report. We have a magazine that we get every month, a monthly called Chiropractic Economics, and some of the Instagram photos come right out of this magazine. But they were talking, they did a study here, and they were talking about minorities and chiropractic. And I found this to be very interesting because as I would be considered a minority doctor, I consider myself a black doctor, but that's the classifications they give us here. And they're saying that more and more people are embracing chiropractic because of its non-drug approach to pain management, certain other health issues and what have you here. And they said that the people who are, the research indicates that people who are black, Hispanic, and of color may not be as quick to see a DC, that's a doctor of chiropractic, for health issues. The reason for such disparity in the healthcare in this area can be multiple. And so it's amazing. But when they look at the breakdown of chiropractors of color versus the non-colored doctors, minority-owned practices, they said that minority-owned practices comprise 14.56% of the practices of chiropractic practices, and the non-minority practices are 85.44. See, so those numbers almost break down into the distribution of population in the country of blacks versus non-black. But what it shows is this number is starting to go up. Now, in terms of patients of color seeking chiropractic care, now they're saying that it's 27% is the number now seeking chiropractic care, and from minority doctors, when just a year or two ago it was 23%. So that number has gone up 4%. This is really good. And so when I look at this, I'm looking at some of the reasons that are would drive a patient toward a chiropractor. Now, one of the things is the type of care. Now, the doctors all will render the standard of care. That's to be expected. Okay, but some of the services that chiropractors offer is a little bit more hands-on therapy for to achieve a certain level of wellness with the patient. It could be corrective. We might be trying to correct a problem that you present with. It might be something that's chronic, and so we have to maintain a certain level of care over a period of time. That could be months, years, that sort of thing. But they give a breakdown as to the percentage of services that we use in care of a patient. They had hot and cold compresses, 51%. Just about all chiropractors going to use some kind of modality. So they got the modalities listed here. Nutritional products and supplements, 50%. See, 50% of our chiropractors use supplementation, and that number is pretty much steady. See, pillows, 48%. Educational materials, 42%. This is really important. That 42% of educational material is a standard, because we have to educate our patients as to what we're doing, which they're not used to. They don't understand it. There's been some negative information in press out about it, and so there's a certain element of fear that's there. Then topical creams and ointments, 42%. Okay, some of the doctors use the CBD oils. I don't use them currently yet, but this is something that we do in our practice. See, and so that's kind of a roundabout type of care. You know, we don't. What I was saying was that you need multiple forms of care. Now, one of the things that's not included in here is one of the things that I've done since for the last 41 years is colon hydrotherapy. Okay, so that's not in here. That's not listed. That's one of the things that I know that the patients need. I was really trained by some old doctors, some older doctors. They all passed on, but the doctor said that black patients, he said, you're probably going to see predominantly black patients. He said that they're going to have digestive issues, which will cause structural issues. So if you go to the structure first, they'll feel better temporarily, but then the digestive issues and the elimination issues will start to supersede the treatment that I had rendered for structure. So we administer colon therapy, not as much as we used to. The patients now have a little bit greater awareness as to their colon and the significance of making sure that the bowel is functioning properly. They have a little bit greater understanding as to their nutrition, how to supplement the diet with certain supplements. And this is important because basically you last longer. Now we know that we will attempt to try to get the patients to fast. That's not in here, the fasting. A lot of doctors are not versed in that, although we did have that as part of our nutrition, but it was not something that was pushed. I had a little bit better background in it because I've been fasting since I was 22. And so 70, so that's 48 years. So I believe that my numbers are off. But the thing about it, I was going to a doctor, a naturopath, who basically that's what she had. She had a fasting center. She saw a lot of people there, and the difficulty in trying to get people to understand that not eating was better for them was enormous. Okay, and she said I would have problems with that. It's getting a lot better now. We have with the internet, there's a lot of information out there. Some of you are there's so much information out there that you suffer with information overload. So trying to get some sort of understanding and implement a program is a little difficult, but you need to seek out a person who is experienced in this. So this is one of the things I had mentioned before, is that it takes time to, just like it takes time for us to get information out and to get you to get a better understanding that there are multiple forms of care. You do need multiple forms of care. You do need several different types of healthcare practitioners in your life. We know that people live longer when they can match up the void of accidents and things of that nature, of trauma. People live longer when they can match the foods with their genetics and their nervous system. Whatever that nervous system is saying, if the food matches that, then basically your functioning of all your internal organs will be a lot better. You'll have optimal success with the functionings of all 9 systems. The systems work better. When there's a mismatch or the food does not resonate with the nervous system, then that's when you get dis-ease. And so what we see basically is a combination of about 4 or 5 disorders. And these disorders basically are considered chronic illnesses. The chronic illnesses basically are something that when they combine themselves, they can kill you because you can develop a cancer as a result of that. So, you have high triglycerides, diabetes, coupled with obesity. It's a combination. It's called metabolic disease. It's a combination of diseases, not just one disorder. It's not just diabetes, or it's not just hypertension. It's the combination of all those conditions that gives you the diagnosis of metabolic disease. And metabolic disease has a component of obesity. It has a component of diabetes. It has a component of hyperlipidemia, high triglycerides, low LDL. It has a component of cardiovascular issues. And so when you couple all these things together, then it's very difficult to identify one specific thing. So that means that you'll need multiple forms of care. When I say multiple forms of care, you'll need to see your allopathic physician. You may need medication. The medication should not be the only thing that you have as far as your therapeutic regime. You need supplementation. You need foods. Now, this idea that food, let that food be that medicine, when I told you about the 4 different levels of disease, well, food could be your medicine in the first 2, your energetic phase and your physiological phase. But food being your medicine is not going to work when you have pathophysiologic and pathological changes that have taken place, and you have these conditions here. Now, all these conditions can be reversed with food. There's no doubt, but it has to be supervised. Okay, you need a period of time where you can go through several different forms of care, one after another. Allow the body to rest, allow the circulation to take place. The body has got to be able to move a little bit when it needs to move. It's got to rest when it needs to rest. It's got to consume nutrients when it needs to consume nutrients. And so when these things are all combined, then you will see changes that take place in these conditions. And these, like I said, these conditions can be reversed. They're only reversed when you put all these therapies together. Okay, and so there's no one therapy, there's no panacea, that includes medication. That's why the medications keep changing. There's no panacea. See, there's no one drug that you can take. There's no one nutrient that you can take. So the patients who are out there, or people who are out there trying to self-treat, my suggestion is that you get that heart rate variability test, because you need to know whether you're sympathetic dominant or parasympathetic dominant, or you're balanced. Most people today are not balanced. Okay, even there are people who are not responding to certain supplements and cannot maintain a vegan or vegetarian diet because they have the wrong diet for the nervous systems, which they don't know which one they are. The diet doesn't match with their nervous system. That's the only reason why. If you are parasympathetic dominant, you need to consume meat. It should be grass-fed, the quality should be good, but you are not a person who can be vegetarian or vegan. You will fail. If you are a person who's sympathetic dominant and you try to mix, you say, I'm a mixer, so I'm going to eat meat. You get into a stretch where you're eating meat, you will get constipated. You will be magnesium deficient. You will be potassium deficient. You will get sick and you will fail. So you need to know which one you are. And it's true. When they match, when they resonate together, you will receive or get or maintain or obtain optimum health. Okay, I think that's enough for this video here. Best in health.